The thing I find most impressive about the Tufts faculty is how much real world experience they have. A lot of them have worked for public health departments, have worked for the federal government, CMS, great nonprofits. And I really find it super interesting to hear where all my professors gain their expertise.
Together with Dr. Fernando Ona, we co-created Tufts Cohere, a community health worker training program. We want to train community members that are culturally responsive, that are familiar with health inequities, the barriers to access to care, to bring people into the healthcare system. That has been really at the heart of what we try to do at Cohere.
Many of us bring our practice into the classroom. For many years, I've taught a course on substance use and addiction, and I have experiential learning trips. We go to 3 different sites and do our classes there, and the classes are taught by those in recovery as well. It deepens the learning in a way that you could never get in the classroom.
We have an amazing cadre of people who are multidisciplinary professionals. Kim is a registered dietitian. Margie is a social worker. Ultimately, all of us are committed to training students. I have done quite a bit of work in maternal health, not only for Massachusetts or New England, but nationally. I started a Center for Black Maternal Health and Reproductive Justice here at Tufts. This center is the first of its kind. We're very in tune with the governor's office, the attorney general's office, and we do a lot of work with our state and local elected officials, and they listen to us because we're doing good work.
My lab is specifically focused on infectious diseases that pass from animals to humans or from humans to animals, planetary health and One Health, and planning for the future of climate change. These types of interventions that we do are completely community-owned in many ways, which is important for sustainability.
I have a project that's funded by the Michael J. Fox Foundation to figure out how Asian patients with Parkinson's disease access to healthcare is affected by their limited English language proficiency. When I have students who can speak Cantonese or Mandarin to do the interviews with the patients and their families, that makes all the difference.
I run an animal welfare organization, and I have done for about 15 years. There are many dogs at risk for poor outcomes, including death, and I wanted to fix that problem. My rescue work is really important to me, and I can't think of a better way to marry my public health work with what I really love doing, which is saving animals.
My research focuses largely on substance use, infectious diseases related to the opioid overdose crisis, related to the HIV and hepatitis C epidemics. The hope is that we can help public health legislators to understand which communities are most impacted and where interventions are most needed.
And I ask my students, okay, what do you think what a cause of a disease actually is? If you have 20 students, you get 20 different answers. And the evidence map that I'm suggesting is exactly that tool for evidence that helps us explain disease.
A lot of the work I do is based in India to understand why people who have tuberculosis may not complete treatment, why they may have disease recurrence. And by engaging students in my research, it serves as part of their education. It allows them to engage with teams of people who are working globally, and it also advances their own research skills, which can then be applied in the real world.
The major areas that I've been involved in are tobacco, alcohol, and firearms. Powerful corporations that have negative influence on policy. That's where I can have the greatest impact. When I started in tobacco control, the prevalence of adult smoking was about 40%. Now it's below 10%. And the number of lives that have been saved is just enormous, in the millions.
My most recent accomplishment has been working as a co-investigator on the Delta Greens project. It's called a Food as Medicine Initiative, and basically it's a randomized control trial that seeks to optimize the health of those in the Mississippi Delta. And being the fact that I am from Mississippi, that warms my heart to be able to help home away from home.
I have been in higher education now for almost 35 years. I've done work with the Centers for Disease Control's Youth Risk Behavior Survey. I'm currently interested in food literacy and what adolescents and young people know or don't know about where their food comes from.
My research interests lie at the intersection of global health and mental health, making mental health care more available to individuals, primarily residing in low and middle income countries. I truly believe that people can make or break a place. My colleagues are not only accomplished researchers, they're amazing human beings. We really care about each other. We really care about our students. I don't know any colleague of mine who does not put their 100% in teaching, and we passionately think about ways to educate and build this workforce for the future.